going on, everybody? I got some killer information, killer news. Well, we got everything nailed down on the erectile dysfunction, the ED clinic for men and women. We're actually putting in our third office. I got 2 of them now. And we have over 10 streams of income. A large part of it's going on the marketing, but the equipment, well, the beauty of this whole thing is we remodeled it and structured the overhead to be a lot less than original and a lot less people to get in. So we're getting in the whole office, 4 people, 4-person staff. You're talking the doctor, the assistant, a closer, and a receptionist. And prime location, money for equipment, and money for advertising. The whole 9, turnkey, and it's working, and the model's killer, and it is a hot business. Super hot. People at 100, or if you want to break it down, we can break it down to $25,000 increments, and this thing is off the chart. If I told you the numbers, you're not going to believe me. So I'm literally going to give you guys lower numbers than what it really is, and I got the proof to back it up. I mean, shit is hot, and the 2 locations we have are kick ass, which we have a business model for the 3rd location that's going to be like the first 2, and it's all about the income of the area and the zip code it's going into in the location. We have the doctor has one himself that is it's actually making double of what we are. It's in a higher end location in California, but man, this thing, I'm going to tell you minimum numbers because the return on investment is phenomenal. So the opportunity is this: if you want to do a $25,000 increment that goes on equipment, or the 100, or the full 200,000, whichever you want to do, or if you want to do get this, you could pay with a credit card. It's under contract. It's on equipment. It's totally legal. It's all backed up by experience, everything, the model, the system, and the return on the money. And you're paying for a partnership. You're buying into the company. This isn't just, hot air bullshit going to nowhere. It's percentage of the company. This is like a really good deal. Anyways, if you call me, I'll go over the details, because to say it over the phone, over the internet like this is just kind of, well, it sounds like bullshit. But for the buy-in, the fact it's on a credit card and on equipment, so yeah, it's hot because we got we got stem cells, we got a P shot, we got the ED. It's basically acoustic shockwave therapy for men and women, and the women's side is hot. It's for couples. We got financing for all the clients that come in there. It's over 24 different lenders for the medical purposes, and it goes down to a 500 credit score and is making bank right now. It's open 6 days a week, and right now, last month, well, I'll just say the gross overall pay what it all brought in was $650,000, and this thing's growing. It had a little slow start. About the first 2 weeks was a little slower, but the 3rd week, when the advertising and marketing kicked in, and now it's off the chart. So we got facials for women. We got all these other things. I can give you the whole lockdown. Why don't you call me and I can go over it? But if you want in a business opportunity, you get in. You're making the money. The only thing is the doctor, since we're doing this, did say that he wants to buy everybody out within maybe 6 months. So the numbers are like this. At 6 months, you'll get the $25,000 back that you originally put up. Your purchase to buy in as part owner at 4% ownership is only an increment of $25,000. It's going to go on for 6 months, where basically it adds up to where you're going to double your money and get back $51,992 in 6 months, plus your original $25,000. So that's literally tripling your money. Once you're bought out, you can take your money and put it in on the next one, because we're going to start opening these one a week. And that's what we're on track for, and just put them all over the place. They're off the chart. So the payouts, month 1 is going to be $3,750, month 2 $4,875, month 3 $7,375, month 4 $9,416, month 5 $11,791, month 6 $14,625. That all adds up to $51,992. Then you'll receive your original $25,000, well, back, since it's been spent on this whole thing to build it and grow it. And that one will be done and over with, and it'll be making money on its own under the doctor's ownership like normal. And then you want to get into the other ones that we keep opening every week. Do it again and again and again and keep making money. This is a kick-ass cash cow. It is hot. We have the 10 streams of income on it, and adding 5 more, and still have other ideas and ways to expand it. And it's only going, 6 days a week. So there's potential we're thinking about doing, which I'm trying to tweak things a little bit, maybe get Sundays open, and then the 24-hour aspect. But this is so hot right now, and the general increment, I mean, the men are paying like $3,500, and the women's are a little bit cheaper for the therapy, and then all the other side facets that go with this business are all very, very high margin profit with low cost. So, and it's medical, and we got the financing for each client to get financing to do that. If it's a 500 credit score, like I said, it'd take them a couple days. But if it's a normal credit score, they get there like in 2 minutes, 3 minutes, and they're approved for their therapy and all that kind of stuff. So this is a hot business, and you're only need 8 people at $25,000. That's it. Boom. Pay the credit card, or you can do wire. Either way, you'll have the contract, the paperwork, everything, and you're covered. So that's that. If you're interested, I'm telling you, this thing's going to fill up fast. Give me a call at 312-473-4163. Thanks.
Hello, my name is Kelsey, and I'm here to talk to you about a new and exciting breakthrough treatment for erectile dysfunction. To help me, I have Dr. Mayer Dollar here to answer a few questions for us.
Thank you, Kelsey, for having me and for discussing such an important and prevalent topic.
Of course, I've been working with you in your office for quite a while now, and I've noticed the high number of patients that we see with erectile dysfunction. Do you have any idea of how many men have this problem?
Erectile dysfunction, Kelsey, is extraordinarily common. 50% of 50-year-old men have erectile dysfunction. 60% of 60-year-old men have erectile dysfunction. 1 in 2 male have some sort of erectile dysfunction.
So it's clear that age plays a role. Are there any other clear risk factors that you know of?
There are many causes of erectile dysfunction, and in most cases it's multifactorial. It could be secondary to neurogenic, vasculogenic, psychogenic, or other.
Can you talk a little bit about some of the treatments that are already available?
Sure. There are 3 medications in the market, Viagra, Levitra, and Cialis. They relax the smooth muscle in the penis and improve blood flow. The efficacy is between 36 and 76%. There is another medication, it's called Trimix. It's an injectable medication that efficacy is about 90%. Every time someone is wishing to have an erection, he has to inject himself with this tiny needle. The last option is a penile prosthesis. All these treatments don't fix the root cause of the problem.
And what do you mean by root cause?
The problem is, as we get older, our tissue also ages. And we see that those changes throughout the body as well as in the penis. The elasticity, the contractility, and the number of smooth muscle cells decreases. Also, the girth and the size of the penis also decreases, as well as decrease in sensation.
Can any of these unwanted changes be reversed?
Yes, I'm excited to talk about a new treatment, the Paydex shot, that can potentially reverse and treat the culprit of the problem. I was fortunate to be trained under the inventor, Dr. Charles Reynolds.
How exactly does this P-shot work?
First, Kelsey, I would like to talk about platelet-rich plasma, also known as PRP. PRP had been around for many years and had gained attention from the media when professional athletes had been using it for sport injuries as well as a performance enhancement.
What is in PRP that helps with healing and performance?
So Kelsey, you remember when you were a kid, you were riding your bike, you fell off the bike, and you had an abrasion on your knee. The clear yellow stuff that came to that area that helped repair and rejuvenate that skin, that's exactly what we are looking for. So essentially that material is full of endothelial growth factor, of healing factor that is going to help and rejuvenate your skin.
And how exactly do you isolate these specific factors for the injection?
We first use a very tiny needle to draw your own blood. We put it in a test tube. We spin it in a special centrifuge very, very rapidly. That centrifuge separates the red blood cells from the white cells, the platelets, and the plasma. Subsequently, we extract that PRP and we spin it again to further concentrate that, and subsequent to that, we activate them and they're ready for injection.
And this is the solution that's directly injected into the penis?
Yes. We first use a very, very strong numbing cream. We inject your own PRP that is full of growth factors. The idea is that these growth factors will help rebuild, regenerate, rejuvenate, and revitalize the penis.
Is it painful?
We have developed a method that is almost pain-free. We use a tiny needle as well as a very, very strong numbing cream.
And is there any significant bruising involved?
You know, Kelsey, PRP is designed to treat bruising, so bruising is minimal.
Can patients develop any allergic reaction?
PRP is your own blood, so you actually cannot develop allergic reaction to your own blood.
Does it require any FDA approval?
PRP is a blood product, it's not a drug. So at this point, it does not require any FDA approval. However, the kit that we use to separate the PRP is FDA approved.
Is there any downtime associated with getting this done?
Downtime is minimal. Most patients can have sex the same night.
And how long does the procedure take?
The procedure takes about 45 minutes, and patients can be in and out the office during their lunch break.
What are some of the benefits that patients can expect?
Well, benefits vary among patients, but most patients are going to feel increase in the girth of the penis, increase in sensation, improve blood flow to the penis, and overall enhance sexual performance.
How soon does one notice these benefits?
Most patients feel immediate increase in the girth of the penis, but this lasts only for 2 or 3 days. The revitalization of the penis occurs after 3 or 4 weeks.
How long do these improvements last?
Duration of the benefit vary among patients, but we have noticed that if a patient does the treatment once a year, that's probably the best sequence.
Can the P-shot be combined with other therapies for erectile dysfunction?
Absolutely. They have an additive effect, a cumulative effect. We encourage our patients, at least for the first month, to use other modalities with the P-shot to enhance the results of the P-shot.